Welcome to the Evidence Hour, leveraging researcher-practitioner partnerships to improve human trafficking prevalence studies. The Center for Victim Research is holding these Evidence Hour webinars to showcase broad reviews that examine an issue of importance to victim service providers, advocates, researchers, and others. It is my pleasure to introduce today's speakers. Rebecca Pfeffer is a research criminologist in the Victimization and Resilience Research Program in RTI International's Division of Applied Justice Research. Her research interests include better understanding and addressing the victimization of vulnerable populations, ranging from survivors of human trafficking to people with disabilities. Additionally, her work focuses on the law enforcement response to human trafficking and the collaborative efforts of law enforcement and victim service providers. Dr. Pfeffer is an expert on human trafficking and has participated in expert working groups on trafficking research with a number of organizations. Kelly Barrick is a senior research criminologist in RTI's Division for Applied Justice Research with 20 years of experience in criminal justice and criminological research. She's an expert on human trafficking and has also participated in expert working groups on trafficking research. Dr. Barrick's current efforts include estimating the prevalence of sex and labor trafficking, identifying successful strategies for the identification, investigation, and prosecution of labor trafficking cases, increasing our understanding of opportunities to disrupt sex trafficking, recruitment, and networking operations, and conducting a formative evaluation of law enforcement-based victim service programs. Terry Galvin is the Executive Director of Community Against Sexual Harm, or CASH, where she leads a staff of trained peer specialists providing assistance to women who have been commercially sexually exploited using harm reduction and trauma-informed practices. Terry has provided training to law enforcement, colleges, nonprofit organizations, and service clubs, and has worked closely with law enforcement agencies to advance demand and person-centered strategies. And with that, I will turn things over to them.
I will kick things off. Terry, and I'm glad to have you all joining us. I am the Executive Director of CASH, and our mission is to assist women who have been commercially sexually exploited through survivor-led peer support and harm reduction services while providing education about the harm inflicted on women. And we are a little bit of a unique organization. Our founding was unique as we were founded by a group of officers, problem-oriented policing officers in Sacramento, and they used a very collaborative approach to create this organization. They worked with professors at Sacramento State, and we are located in Sacramento, California, and a local business district that was being very impacted by prostitution activity, and women who were involved in the sex trade, to come up with a solution that would be an entry point, a very low barrier entry point for women who need services and who were seeking alternatives to life on the streets. Were modeled after a program in San Francisco, and the most important aspect that we carried over, it's in our mission and it was mentioned, is that we use exclusively women with lived experience to run the programs and inform our work. We have been providing services since 2013, and we have grown from a very tiny organization to a full-fledged small organization. We are also the lead organization, the lead agency for this research project.
Thanks, Terry, and I can give a little bit of background about RTI. RTI International is a nonprofit, nonpartisan research institute with an expansive portfolio. We have several different groups that do work relevant to human trafficking, and our human trafficking portfolio is informed by researchers with backgrounds in social work, criminology, public health, psychology, and we regularly collaborate on a number of human trafficking related projects. In general, we try to work together to advance our portfolio, advance our understanding of both sex and labor trafficking, and use evidence-informed strategies to improve a multi-sector response to both sex and labor trafficking, and to think about it at the individual level, the community level, and institutional levels. We have worked on a number of different projects involving considering the prevalence of human trafficking, and we're really excited to get to talk about one of those in particular with Terry today. I think we can go to the next slide. Terry, did you want to mention Sac State?
I did, yeah. And the final partner with us is the Institute for Social Research at Sacramento State. They are an interdisciplinary center, and they work to improve programs and policies within the Sacramento region and throughout the state. They are experts in conducting survey research, performing program and policy evaluations, and in conducting applied social research. I think that one of the reasons we all work really well together, or one of the key things to us working together, having RTI, ISR, and our organization, is that we all have a pretty well-defined roles. Later in the presentation, we'll have a slide that shows exactly, what we're each doing. But I think the important part is it feels like we all have very significant contributions to add to the project, and we work together that way. ISR is here locally with me. We're obviously not a research, we're a direct service organization, not a research organization. And then RTI, we were fortunate to, they're very well known in this space, and so we were fortunate early on to be pointed in their direction to establish the partnership.
If you don't mind advancing to the next slide. Next, we wanted to get a little bit of a sense from you all to better understand who is here today. So if we could launch the first poll. We're just wondering who is here so that we have a better sense of how to tailor this conversation. And I'm not sure if it just, oops. Oh, great. All right, so we have a little bit of everyone, and unfortunately that other category, which would be really interesting to understand, is about a quarter of us, so maybe we'll get a chance to get into that a little bit more. But it's great to know we have so many victim advocates and service providers here, and other researchers and others. Can we advance to the next poll? Oh, there's one more poll. Thank you. There's no wrong answer to this question at all. But we're curious about people's perspectives on that. Okay, well, I don't know if everyone is being nice, or if this talk just drew in people who are interested in this question of prevalence. But it seems like many of us agree that understanding prevalence is important. So thank you for taking those polls, and we can, I think, move to the next slide now. So understanding prevalence has been sort of a sticky issue within the anti-trafficking movement for a long time. And one of the problems is that these prevalence estimates can range so widely. We have here some of the estimates ranging from 12.3 million to 20.9 million to 45.8 million. And with a span like that, you almost lose the meaning of asking this question and answering the question. So it's commonly understood that human trafficking is a widespread problem, but the actual scope of the problem is not well understood. The variation in estimates also calls has led some to argue that claims about the scope of trafficking might be questionable. And further casting doubt about that is the fact that there are relatively few human trafficking arrests, charges, and convictions. So we talk about this like it's a giant problem a lot of the time, but then the actual evidence supporting the scope of the problem seems much smaller. Probably a lot of people who are attending this webinar understand that the way that using law enforcement outcome data is not an effective way to totally understand the scope of prevalence, but it's still an issue. Actually, in recognition of the complex nature of human trafficking, the US Department of State stopped reporting prevalence altogether in their annual reports in 2016, with the understanding that these reporting numbers that were not accurate or not helpful might have been doing more harm to the anti-trafficking movement than good. If you don't mind advancing to the next slide. So estimates can be so broad and inconsistent for a number of different reasons. One, obviously, it's hard to measure a hidden population. So the typical ways that researchers would reach out to measure the prevalence of any number of characteristics or even victimization experiences don't work for human trafficking victims. They're not coming forward to self-identify. Even if you can, if you do a household survey, it's not likely that you're going to pick up a reliable estimate, and it's not really realistic to do that. And differences in legal definitions of trafficking are another problem, in that if you try to use, California's legal definition and Texas's legal definition, they may not be aligned, so they're not necessarily measuring the same things. Beyond legal definitions, individual studies differ in how they conceptualize and tally trafficking victims. So, and that is also informed by local culture and local laws. So a study of human trafficking victims in the United States is going to be different than a study of victims in another country with different definitions, different legal working ages, and different cultural circumstances. And then different types of data can be used to calculate estimates, and that becomes problematic in other ways, which we'll talk about a little bit more later on in this presentation. Can we please advance to the next slide? So why do we try to measure prevalence? Despite these shortcomings, despite the problems with this question, there are benefits to actually understanding the prevalence of trafficking, especially locally. So for community agencies and service providers, it's important to know how prevalent trafficking is in terms of informing programs, tailoring interventions and prevention strategies, supporting requests for funding, or better understanding the populations that they're intending to serve. For policymakers, accurate or better informed prevalence estimates can help provide evidence to support decision making, and can also help counter misinformation, which is especially important right now. For law enforcement, prevalence estimates can help provide evidence to support appropriate staffing for anti-trafficking efforts, to enhance political will to prioritize those anti-trafficking efforts, and to provide incentive to better understand how adequately law enforcement agencies are identifying cases. And for the research community, this work around prevalence measurement adds to a growing body of work around methodologies for reaching hidden populations. So we both draw from what other work is going on for other hidden populations and contribute to that body of research. I think we can go to the next slide. Thank you.
As Rebecca mentioned, there are a number of benefits to measuring prevalence. So the question becomes how? Calculating an estimate of the number of individuals who have experienced trafficking is really complex, but there is a growing recognition that it's necessary to improve the methods used to generate these estimates. A critical first step is to better understand methods that have already been used in human trafficking prevalence studies. So we're going to share a few slides based on a comprehensive scoping review of prior prevalence studies that we conducted with support from the Office of Planning, Research, and Evaluation in partnership with the Office on Trafficking in Persons at the Administration for Children and Families. I'll provide a real high-level overview of the methods we identified next, but will not be getting into the weeds. So if you're interested in learning more about the strengths and weaknesses of these approaches, the findings are available in a report published by OPRE, which is pictured here, and also in an article in the Journal of Human Trafficking. It is available via open access, so you do not need a journal article or library subscription to download it. Next slide, please. So we identified 44 studies that estimated the prevalence of human trafficking across the world. These studies varied in terms of geographic scope, focusing on global, national, state, or local estimates, types of trafficking, sex, labor, or both, victim age, some interested in minors, others adults, others both. And they also varied in terms of the types of data and the specific sampling and estimation strategies used. A key takeaway we had after reviewing these studies is that there's no one approach for designing either small or large-scale prevalence studies that are going to be feasible with all target populations. Trafficking occurs in diverse settings in both legal and illegal industries, formal and informal markets. It includes commercial sex, construction, beauty services, traveling sales crews, among others. Individuals of all ages and genders are vulnerable to trafficking. Moreover, trafficking is not geographically constrained, but rather may be found in urban, suburban, rural, and even frontier communities. So given this variation in where and how trafficking occurs, methods may need to be tailored to the specific population and setting of interest. For example, methods used in a study designed to estimate the prevalence of sex trafficking among domestic minors in New York may not be appropriate for estimating the prevalence of labor trafficking among adult migrant farm workers in a rural area. Next slide, please. Although there was a lot of variation in the methods used in the studies we reviewed, most of the studies used one of the 5 strategies listed on this slide, and I'll give a quick rundown of each. Studies using traditional probability samples rely on an existing sampling frame or a list of individuals that are in the population of interest that you can then select a sample from. These techniques use random selection, and they're typically appropriate when the total population size from which your sampling is known. In trafficking research, probability samples have been used a little bit, for example, in household or school surveys. And probability samples are considered the gold standard in survey research. However, it's not always feasible or appropriate for studying human trafficking in many contexts. As Rebecca mentioned earlier, trafficking victims are a rare and hard to reach population, which is going to be difficult to capture in just a general household survey. So respondent-driven sampling, RDS, and other link tracing methods are used when a sampling frame is not available. So these methods involve chain referrals among participants. So similar to traditional snowball sampling, which some of you may be familiar with, these methods involve initial study recruits that are referred to as seeds, who fit the eligibility criteria for the study, and then they refer additional people who then also refer others, and so on. RDS and these related methods are appropriate for estimating the prevalence of both sex and labor trafficking in a wide variety of settings. However, because the procedure relies on peer recruitment, it's only feasible when individuals in the population of interest are socially connected and actually able to contact others in the population to refer to the study. So this approach may not work in industries where workers are physically or socially isolated, such as domestic workers. Time location sampling, or TLS, begins by establishing an understanding of where and when the target population tends to congregate. Then it's possible to develop a list of locations, days, and times where they gather, and to randomly select some of those to do data collection. TLS does not rely on seeds or other participants for recruitment like RDS. It does assume that the population is likely to gather at the same venue for work, errands, socialization, or something else. And that assumption is unlikely to be met in many situations, or it may only capture a subset of the population. Instead of focusing on how participants are sampled, multiple systems estimation and mark recapture both assess the frequency that individuals are repeatedly identified through 2 or more data collections. These approaches are different in that MSE uses secondary data on individuals known to have experienced trafficking from multiple sources, such as from law enforcement or victim service providers, while mark recapture involves the actual identification of people multiple times through primary data collection efforts, such as a survey. In broad terms, these methods rely on examining the extent to which individuals are captured more than once to estimate the total number of individuals who have experienced trafficking. One of the benefits to MSE, at least, is that you don't have to sample or survey people who have experienced trafficking, but you do have to get data on individuals who have experienced trafficking, and that can be difficult with different agencies have different record keeping practices, which may not be compatible for list matching, or they might not be willing to provide data for these purposes. And the last method I'll mention here is called network scale up. It's unique in that it doesn't require surveying or collecting administrative data about the target population at all. It relies on a general population and asks survey questions about their network. So about how many people the respondent knows who have been trafficked. So you might ask someone, how many direct care workers do you know? And then how many of them have, and then a list of indicators of trafficking. One of the downsides here is that it relies on third-party information. And so the data may not be reliable because people don't often share their experiences of exploitation and trafficking. Next slide, please. So there is no one-size-fits-all strategy for estimating prevalence, and estimates from one study not going to be generalizable to different contexts. None of these methods are perfect, and nor will they work for every situation. And so determining which method is most appropriate depends on a number of things, including the population that you're interested in, the specific industry, be it commercial sex or another labor sector, and potentially the geographic area of interest. Next slide, please. So although there is no best method for estimating prevalence, practitioners are critical partners in the success of this type of research because they're the experts on the local context and the population. As researchers, we may be able to design a perfect study on paper, but it requires the expertise and support of practitioners and those with lived experience to really successfully carry out this type of project in the real world. Gaining an understanding of the local context and at-risk population is absolutely critical, regardless of which method that you're going to use. Some methods, though, do require more specific types of support from practitioners. For example, you can't conduct multiple systems estimation without data from practitioners, such as law enforcement, victim advocates, social service, healthcare, child welfare, and others. And for methods that rely on surveys, practitioners play a critical role in either helping to identify those initial participants who will, start the chain referrals for RDS, or identifying the most appropriate locations and times for TLS. And now that I've provided a little background, I'm going to turn it over to Terry, who's going to introduce a study that we are collaborating on right now to estimate the prevalence of sex trafficking in Sacramento.
Next slide, please. So I'm going to talk about how this particular study came into being. It has a funding source that was a little different than I think many research projects, or at least ones that I'm familiar with. It is funded with local assistance funding. This is a one-time funding that we were able to access that isn't only reserved for research projects. It can be used for a multitude of things in a community. We were given the opportunity to talk to Senator Pan and Councilmember Guerra here in our local area about what we would do if there was one-time funding that was of a significant amount, what would be the best thing to do with it. And this came after many years of having conversations that I know many of us have about not having good data, not having something we can rely on, not having proof of what it is that we feel like we know working on the ground here day after day. And yet we're asked all the time, well, what is the scope of this? Who is affected? You know, and we're asked by funders, we're asked by policymakers, the people Rebecca talked about. And truthfully, at the community level, we really don't know. We don't know here, at least in Sacramento. The other thing is, it seems incredibly hard to get really meaningful prevention work started absent having some of this data. And so for us, that was really a motivating force, and us being also Senator Pan and Councilmember Guerra really trying to move the dial, that was very important to them. So that's how we were able to use this funding source, local assistance funding, to craft this project. One of the things that we wanted to be able to show here was that because of the complexity that we've talked about, and the studies that have been done, where they've been done over 5 or 10 different cities, and they have sex and labor, and they have adults and minors, and you know, so much embedded in them that it's hard to take any lessons out of them. It's hard to understand at the local level how we can now make some meaningful targeted change. So we wanted to look at what happens if we take a deep dive and we reduce down what we can so that we're looking really, really specifically. And so that's how the project has been kind of designed, and that was what we wanted to do here at the local level. But we wanted to do it in a way that was very accessible. So the partners that we use, the way we're doing it, the methods, using everything that can be replicated anywhere in California or elsewhere for sex or labor, that was really well documented and really thoughtful, so that we'll have something that can be built upon or understood by many. So that was the other part of how we've designed this project. I think that for us, and certainly for the policymakers here that championed this, they did feel like this was an investment in us being able to move forward in helping solve this problem here. Next slide.
All right, so because of the various strengths and weaknesses of the prevalence estimation methods and the need for a rigorous estimate, we were a little ambitious, and we decided to attempt 2 different prevalence estimates using independent data sources. And both of these methods are ones I've mentioned earlier. We're using multiple systems estimation with the administrative data. Terry has identified and engaged local agencies and organizations who interact with sex trafficking victims in Sacramento. And we've requested data from 9 different agencies and organizations, including law enforcement service providers, healthcare providers, and child welfare organizations. And so that is one method that we're using for prevalence. We are also using respondent-driven sampling to recruit and interview a sample of individuals who have sold or traded sex in Sacramento in the past 5 years. And the interviews with these individuals covers indicators of trafficking, which are needed for the prevalence estimates, and additional topics that would further help inform the local response to trafficking. We wanted to ask about everything, but our team had to collaboratively determine which topics were going to be a priority and which were going to be most useful for Sacramento in informing their response. Whereas the multiple systems estimation only yields the prevalence estimate, this other estimate, where we're conducting interviews with those involved in commercial sex, will be used for another prevalence estimate and to explore these additional topics of interest. For example, we have a series of questions about recruitment and entry into the sex trade, social networks of victims and traffickers, the availability, access, and satisfaction with services, impact of COVID, and more. So although prevalence is important, it's not everything. And so I just wanted to highlight that, using the interviews to go beyond prevalence to collect additional information to help inform the local responses is also important. Our interviews are still ongoing, so I don't have anything to share on that. But I'll turn it back over to Terry, who's going to talk about the central role of CASH and the Survivor Advisory Council on this study.
Advance the slide. So when I thought about this, talking about this, I thought that, one of the main roles from our perspective has really been to keep focus and enthusiasm on a 3-year project. As a direct service provider, we run in 1-year grant cycles, maybe 2-year grant cycles that feel a little bit more like a sprint. And this project has felt like a marathon a little bit because, we've had people retire that we've identified and worked with, and just a whole lot of change. So part of my role as the lead agency has really just been keeping it at the forefront and as a primary function of what we're doing and keeping our board and our community informed. So that has definitely been one of my roles. And having that connection with all of the stakeholders, the people who are involved in the project and those that are just in Sacramento, and for them to understand that this is going on and how this is going to benefit us. So all of the community work is one of the central roles of my organization. I've also had to help establish all of the data sharing agreements, and that is quite a job because we have, as Rebecca or Kelly mentioned, there's lots of different ways that people collect data. So first was understanding who had data that would work with what we're doing and had met kind of our criteria, and then informing them about the project and then creating data sharing agreements. And while the willingness was there, and I do want to say that Sacramento has a very collaborative spirit, and we have a anti-trafficking coalition established, and we have had that established since about 2015 or 16. So we have a real collaborative effort here in general. So everybody was very willing to participate in this project, which was amazing, but everybody still had the sensitive data, all of their own requirements. So getting through all of that was really the first year's work, establishing all that. So that was a key function of us here. The other thing that came up, and it certainly came up early on, was why, when given the chance to have funding, did we support a research project versus money for direct service providers or general capacity building, right? So that was some of the feedback, obviously, that the community wanted to know why we championed this effort. I think that when explained, or when people really understood the fact that we can't move the dial, that we can't continue just to say, well, we don't know, or we're relying on things that or don't meet our needs well at all, and we have an issue with so much misinformation and myths and hiddenness, that this was our opportunity, and probably a fleeting opportunity, to actually do something this deep. People did understand that long range view that we were all going to benefit from that. But that was certainly part of the practitioner's role here, in explaining that at the community level. We also had to, in partnership with ISR, train all of the people who were collecting data, because we're using that MSE model. So we have protocol, and we had to have handbooks and all of this stuff. So there's just a lot of work around the systems to collect the information and have it uploaded securely and all of that stuff. So we were fundamental to it happening smoothly. All of the details were handled by the researchers and what was needed. The other thing is the role of the California Department of Justice. because we are a small organization, it was decided that the DOJ would administer this grant, which causes a little bit of confusion because some people are used to having DOJ fund research projects like this, and they're not actually funding this project, but they are administering the funds because it just assisted us with our capacity to do such a thing, and it just added another layer of transparency about the whole process and the project and what we do. So we also interact and maintain a relationship with the Department of Justice. I advance the slide. One of the most exciting parts of this project has been this participatory approach that we're using. We established a survivor advisory council very, very close to the beginning of the project. That's our nature. We're a survivor-led organization, so it made sense for us that that would be the next thing we would do with this project as well. And so they have been involved from the beginning with designing the instruments, coming up with and then whittling down the long list of questions that we had at the beginning when we wanted this opportunity list us everything in the world, and they were fundamental to saying that they thought this was more important than that. This is what they feel like people need to know based on their experience. We just worked through all of that. So they've been very informative to this project on every level. They also helped us design the interview and recruitment protocols, the incentive structure, what we really need to consider when we're looking at these things. And then we're starting to talk now about how we're going to talk about the results and how everything is going to work. I mean, the Survivor Advisory Council they were not a small part of this project. They were deeply embedded into every aspect of what we're doing. They are doing the interviews. They've been trained to do the interviews. We have lots of support on staff because it is a heavy lift to ask survivors to interview people who the research instrument is still a heavy instrument, so we really have built a lot of things in place for that. But they're enjoying that work and really excited to be a part of it, and looking forward to being part of the analysis. Next slide, please. Next slide, please. So knowing that I was going to come and do this webinar at our last meeting, I asked what they wanted me to let you all know about their participation in this project. So this is some of the stuff that they said. First, that they learned what goes into a research project. Kelly and Rebecca and Christina, she's not on today, they've all come in, zoomed into our meetings. ISR, our research team here, they've come to the meetings and did the trainings in person. So they really have learned all of the people and what it looks like to do a research project of this nature. And they were unaware that there were so many people interested in stopping sex trafficking locally. It's an isolating, type of issue. And so to sit in company of so many people putting so much effort into this has been really rewarding for them. It's been very exciting for them to be on team with Kelly and Rebecca and Christina and ISR staff. They do feel like this was a unique opportunity to contribute significantly to this issue. That absent this project, there wasn't anything available in our community that gave them that same ability to contribute to an outcome like this. They have a more expansive view of trafficking because as we sit together and we discuss everything, they have learned all of what's going on in Sacramento County, not just what had happened to them and what their circle looks like. And so they have a broader view just amongst themselves. And they are excited to have a project that will influence some of the systems that they've been a part of or they've had either positive or negative experiences with, they're really excited to be able to do something that can be useful, and are grateful to be viewed as experts, to take their spot as having their experience considered as strongly as it is, that they are the experts in this, and we are taking our direction from them. They've been very grateful for that opportunity and feel very empowered by that. Next slide. Here's the roles I promised you at the beginning. This is how we divvy up the work of this project. You can see that we're doing the interviewing, we're getting the data, we're soliciting the data from the various sources and staying in contact with them and managing the project from that level. ISR has gone through the IRB approval. I think we have several IRB approvals at this point because we have all different partners and we've had sensitive data. So we have several IRB approvals, and they're managing the recruitment strategy and how the process is a little technical. So they're helping us with the interview process and doing the transcriptions and so forth. So as I said, we all have really specific roles that don't overlap. It's taking all of us to do a project of this scale, which is something that I've learned personally, to add all of these methods or try these different things. There's a great deal of work. And so we meet as a team and we stay in really good contact, and we have from the very beginning to troubleshoot any problems and make sure that we've not veered off course at all. And then we're going to work together to do our final deliverables. I don't know if you guys want to say anything additional about the rules.
Can we advance to the next slide? Thank you. So some of the things we've learned from this collaboration, I think the most important point is that partnering together so closely and carefully has really enabled, for sure, deeper community access. So from a researcher perspective, you know, Terry is so well trusted in Sacramento and the surrounding community that, you know, asking for something like administrative data about highly sensitive population is something that RTI couldn't do, but it is something that she can do. So working together enables this deeper community access. And then also, you know, we are able to offer our research skills to Terry. So it's sort of a really reciprocal relationship, but it takes a lot of trust to get to this point. And I think one of the key points is just that we have to trust the expertise of different project partners. So Terry really puts the trust in the research process with us, and decisions about the best types of prevalence estimation strategies to use here, and decisions like that. And we have to trust Terry's decisions and are able to rely on her incredible management of the advisory council. And part of this is a big partnership, but a really fruitful partnership for everyone. I think the other piece is that survivor engagement is so important to this process. And we've learned that isn't a static. You can't make decisions about that early on and expect them to stay the same throughout a whole 3-year project, because everybody is growing and learning and becoming more aware of the strengths of everyone, including the Survivor Advisory Council had to learn, you know, what this research process was, and trust their input. And we sometimes have made decisions that needed to be revisited, and the only people that could tell us how to do something better was the advisory council. So I think we have, as the project has gone on, we have called upon their expertise more and more and more, which is a learning a learning point for us as the research team. I think moving forward, we'll continue to really draw upon the expertise of survivors to the extent that we can, but that's really reliant on our relationship with Terry. And Terry, I don't know if you want to add anything.
Just that I do think that we have, when we established the council, like I said, it's culture for us that we knew it was the right thing to do. But I do think it has evolved and been even more fruitful than we estimated, and that the team has stayed together. And so that has enabled their impact to be even greater. And certainly when we come up with our findings, and we're discussing that because they have stayed together for the entire time, I think that we've been pleasantly surprised about the process.
And I think we can advance to the next slide, and we've left a little bit of time for questions, and we're happy to field those.
All right, thank you. I want to remind folks that you can enter your questions into the question tab. We've had a couple of questions come in already. The first, how do you avoid double counting clients who are served by more than one agency? Do you give them an identifier number, or what other strategy do you use?
That's a great question, and something we worked hard on at the beginning. So we ask for we have asked for, instead of giving us personally identifiable information, to use a code that takes digits and letters from a person's name and birth date, and we can compare those across lists. And actually the point is to double count them if they've been touched by multiple systems, because that's a critical part of the multiple systems estimation analysis.
Great, thank you. Another question, since you are using peer reviewers, what kind of emotional support do you provide to avoid vicarious trauma or triggering by some of what they might hear in these interviews? Or has that been an issue?
So it is something that we built in, again, because we are a peer-led organization in general. We have a licensed therapist on staff, and so we have built her into the interviewing times. And so our main interviewer, the one that is here the most often, she actually meets with her every single week, just because she's doing more interviews than everybody else, and everybody else has access to her whenever they need her, or if at our suggestion, if we think that something's been very, very heavy. And then we're here. So we are doing the interviews in our Center for Women. And so every interview that's conducted, either Sawan, who's my director of operations, or myself, we're in the building. So we're always checking in. And we've done the interviews ourselves as well. So we do know that they are heavy. So we're able to kind of check in a real personal way, and to make sure that there's space in between interviews, or if it seems like we're back to back, that one of us will pull an interview, just so that it doesn't, we don't run that risk. So we're very careful about that, and it is a very real concern.
Were there any male survivors engaged in interviews with males? So were you able to have same-sex interviews?
So yeah, so we had the ability to do same-sex interviews. We have on our project team a subject matter expert. He is actually in Florida, but he is part of this project, and he is able to do the interviews via Zoom. We have the ability to do that and a protocol in place for that. We have interviewed males and given them the option, and they have opted to interview with us because they either know us from the community, or somebody that they know knows us from the community. So that trust was already kind of conferred to us. But we do have the process in place for that. That's a great question.
Can you share more about how the funding worked and how roles were distributed as far as collecting and analyzing the data? And how would someone else start this process from scratch?
So I can't say, Kelly and Rebecca, we haven't. We are collecting data now, and analyzing is this last stage. You guys can nod in agreement that we can't speak to just yet. I'm sure there will be other webinars when we're ready to present all of our findings. Again, the funding came. There was a funding opportunity, and these show up in community. And we had a really good relationship with our policymakers. And I'm just the kind of person who talks about what I wish would happen just regularly to everybody, so that one day it happens. I really don't have a better way of explaining how it goes. But it is a commitment to saying, I think this is what our community needs. And when there is money available from various streams, and every policymaker, every person, every funder, they have access in different ways. It's really just staying on top of that and saying that this is something our community values and we want to do, because it does take funding. And then we have contracts with everybody, and then we just had to take the funding and go into contract and say, this is what we have. What can you do? What will this look like? And so that was the very beginning part of it all. But I think that it is, the first step is identifying that you have a community that could do something like this and would be interested in it, and then letting people know, don't keep it close to you. I don't know if you guys have any other ideas.
So I'm going to follow up on the roles about analyzing the data. Because I know that there will be, you indicated that the Survivor Council will have some role in interpreting findings, or can you say a little bit more about how at that stage, because I'm sure that the researchers will play a heavy role in doing the, analyzing numbers and looking for themes across interviews, but how will then you re-engage the survivors in that piece, the Survivor Council?
So our intention right now is and even early as we're starting to have preliminary information, it will be fed directly into the Survivor Advisory Council, and Kelly and Rebecca and the team will say this is what they're making of this information, and then we will see whether that seems accurate and whether that is what, given the data that's in front of the Survivor Advisory Council, whether that's they see as well. So we expect to really have it be a very collaborative process, and just to do a lot of listening. This is what we're seeing. This is what we're making of it. What do you guys make of it? What do you think? And just build that way. We meet monthly as a council, and we have for the entire time of this. So they're very used to getting parts of this project to look at and to see if, and a very, very active group. So if they think something seems off or stupid, they say, I don't understand this, or who thinks that?
All right. Another question has come in. Did the researchers or practitioners who have established relationships with survivors interview youth survivors? And did you encounter any difficulty in interviewing the survivors? I assume that means of the youth survivors.
Rebecca, do you want to take that?
Sure. We did not include minors in this study at all. So we were focusing on adults in Sacramento County. That was, I think, the intention of the project from the beginning. So unfortunately, we can't speak to that because they're not part of the study population.
I think the other reason behind that was it would have been even more difficult to get all of the approvals to interview minors. And again, so we were trying to limit various some of the variables or some of the difficulties that we could do a real deep dive. Now, many, as you guys know, most of the women that we are interviewing as adults today were involved as minors, vast majority.
Another question, are there any interim findings that you've already have or are anticipating that are worth exploring regarding differences with male victims and female victims?
We haven't gotten to that point in our analysis yet, but stay tuned.
Another question, are any of the survivor council members able to use this experience as part of an educational endeavor, like a formal internship or similar credit for their engagement?
Nobody has asked because they're not, nobody right now is in a program that would be able to use it that way. But it had anybody, or if going forward that comes up, I would think so. Yes, I think it would have been an amazing internship opportunity if that was something that they were doing. It has, though, definitely contributed to their feelings about being involved in just the greater community, their voice in making change. I mean, so there's been a lot of very positive things that have already come out of it, and knowing what we know now, and I think as people do replicate, that's a great suggestion that they look at that from the beginning and structure it that way or make that offer. Definitely was an experience, such a learning experience that would qualify it.
All right, we have just 2 or 3 more questions. First, this is an amazing project. Given its breadth and complexity, can you give us an estimate of what the total budget was? I think you might have mentioned that earlier, but it was really quick.
The 3-year budget for the entire project was $1.5 million.
1.5 million. Thank you. Are the interview questions available for review and use by service providers working on data collection? We have some folks that don't want to reinvent the wheel. Or would you be willing to share if asked?
We haven't talked about that. I can't see why not. I think part of the intention of this project is to be as transparent as possible about the whole process. But the research team hasn't. We all looked at each other like, who wants to answer that? Because we haven't actually talked about it. But I think we would certainly be open to that as part of sharing this entire process with the field.
Great, and I'd like to remind people that the Center for Victim Research does have an instrument database. So we will be asking you all if we can get a copy of that, perhaps at the conclusion of the study, to include in that instrument database. Here's another question. Do you have interviewers with varying identities by race, gender identity, sexual orientation, etc.? I know we talked about male versus female. And are the intersectional identities of respondent survivors themselves measured?
So we have, yes, we have a cross-section of people doing the interviews from all of the categories that were listed. And then we are collecting some information on the interview description. We have a little bit of demographic information.
All right. So that concludes our questions. I want to thank all of you for this fascinating presentation on such a challenging but worthwhile topic. Thank you so much for the work that you're doing, for the lessons that you are learning, not only about measuring scope, but engaging survivors in these efforts to make a difference. It's been really inspiring to hear from all of you, and I think I speak for the entire audience that we can hardly wait to see the report. Maybe we'll be able to have you all back once that's finalized and you have results to share. All right, so that concludes today's presentation. Remember, folks, if you would like to receive a copy of the slides or need a certificate of participation, please do take that feedback survey that you will receive. And with that, good afternoon, everyone.